Welcome to the Essential Self-Care Podcast, a show for those of us who are, let's face it, too busy for self-care. Each week, we bring you real-life stories and expert insights to help you create a kinder, more compassionate relationship with yourself. I'm your host, Dr. Sheetal Ajmani, a physician with over 2 decades of experience blending Eastern and Western well-being practices. As the founder of Radiant Living Institute, I'm here to help you reconnect with your own inner radiance. Remember, small changes make a large impact, and it all starts here. Please note, this podcast is for educational purposes only and is not medical advice. Always consult your own healthcare provider about your specific situation. Now, let's get started. Welcome back to the Essential Self-Care Podcast. I am so excited to welcome back a guest to the show. Today, I have the pleasure of welcoming Dr. Sarah Wittry back to the Essential Self-Care Podcast. Dr. Wittry was on the show with us a few weeks ago, sharing her personal self-care journey. Today, we're going to dive into her professional expertise a bit more. And so a little bit about Dr. Wittry. She is a hospice and palliative medicine physician, and she is the founder of Vibrant Humans, which is a podcast and coaching practice dedicated to helping professional moms reclaim their time and energy for a more vibrant and balanced life. So, as I mentioned, today, Dr. Wittry is going to share a bit from things that she's learned as a practicing hospice and palliative medicine physician. So I'm really excited about what we're going to dive into today. Welcome to the show, Dr. Wittry.
Thank you so much. I'm happy to be here talking again.
Yeah, absolutely. So I think to start off, because while many of our listeners, many folks who tune into this show do work in healthcare, many do not. And so can you just, let's just kind of set the stage here. If you could just share a little bit about what a hospice palliative medicine physician does.
Sure, absolutely. So hospice and palliative is a subspecialty that almost any type of physician can pursue as a fellowship. And the focus of what we do is we work primarily with patients who have life-limiting illnesses. They have a prognosis that is sometimes on the order of months, a lot of times on the order of several years, but something that is expected to shorten their prognosis. And we work in a team setting, so we work interdisciplinary team with, social workers and spiritual care and pharmacists, and our whole goal is meeting the patient and the families wherever they're at. We work in an inpatient setting, so when people are admitted to the hospital, and we help a lot with managing symptoms like really difficult to control pain or nausea or anxiety. And then we also talk about what I call kind of the big picture. So kind of talking about how things have been going for them lately in their lives and what they have going on medically and kind of all the complexity, really kind of break it down for people and give them sort of a broader view of kind of the big picture. And then we really are trying to get to know patients outside of their medical illnesses, kind of what's important to them, what they prioritize, what they value, and what they're hoping for and worried about, and all of those things. Just it's really like a human to human type of specialty where there's pretty deep connections and vulnerable conversations happening. Because from that place, we are able to then plan, the next steps of their care and what kind of all the medical teams should be focusing on based on what's kind of most important to them. And for some of our patients, a lot of our patients actually, they want to pursue aggressive therapies and continue, life prolonging therapies and treatments. And then for some patients, they reach a point where those are causing more harm than they are good for them. And their quality of life is very poor. And so then we help them in that transition process to more focusing on comfort measures and dignity and kind of making that whatever time they have left, the best possible quality time. And that's when often patients will get referred to hospice care, where they can still live for, weeks or months, or we've had some patients on hospice for a couple of years. So it just depends on, what's going on with them.
Yeah. Thank you so much for that wonderful description and explanation of many of the different aspects that you take care of and manage and partner with patients and their families through. And, one of the reasons that I really wanted to have you on the show to specifically talk about this is because you play such a unique role in people's lives. That time frame where an individual and their family may be navigating the a new diagnosis or an existing diagnosis, but where they are given this, prognosis. Um,
Hmm.
there must be so much going on there, and to be able to play a role in their life at that critical time, and at a time when they are perhaps thinking about planning for their transition um,
Hmm.
from this physical form. um, I can imagine that as a physician serving in that
Hmm.
role, um, the types of sort of insights or perspectives or lessons learned, or even maybe gems of wisdom that you have gained simply through working with this specific population of patients.
Hmm.
And so that's where I wanted to dive a little bit more into here. Um, so yeah. So I'm just curious what comes up for you when I present that sort of topic in
Yeah.
question.
Yeah, no, you're absolutely right. I think it is, to me, it's really a privilege and an honor to be able to be in that space with people because it is such an incredibly vulnerable time for them. And, I look at it as people having different degrees of like acceptance of what's happening, right? And kind of on different timelines of where they're at as they are kind of prepared, like receiving this news, coming to this realization, and then looking ahead to what time they may have and how they want to spend it. So I think it's a time where we engage in a lot of life review with them, right? And kind of reflecting on some of the things that have been most meaningful for them, some of the people and experiences that have kind of shaped their life and what it's been, which can be really illuminating. I think there's such a wide spectrum in terms of what people, what comes up for them. And definitely there are kind of common themes that we tend to see, right? And
I was just going
so,
to ask that. That was the question that was
yeah.
coming to my mind, is that if, like, obviously there's a lot of, very individual things that will come up, but if there were any sort of general common themes that
Hmm.
you have noticed that individuals at their, during this time, towards the end of their life in this physical form come up for them.
Yeah, yeah. So I think that for a lot of people, it's like a reckoning a little bit with their identity. And so what I mean by that is that, they kind of have a chance to really think about and verbalize some of the um, how they've spent their time in their life, and what their major focuses and priorities have been. And for some people, that's really positive, right? It's like, I'm so glad I did, you know, pivoted in this way and took this other job and did this because I was really following my heart and my passion, right? Because I wasn't happy in my career. I wasn't around my family as much. And so I'm so glad I did that and look where it led me kind of thing. Um, and then there's definitely the opposite where people have like a sense of um, sadness or regret about sometimes, a lot of times people will talk about, I wish I wouldn't have spent so much time working or stressing out about certain things with work and money and just like that being my focus, rather than spending that time with my kids or traveling with my spouse or those types of things. And so I think one of the biggest consistent themes we see is really like people reflecting on um, yeah, the fragile nature of life, right? Like
Mhm.
not knowing what's going to happen, the unpredictability and lack of control that we have, but also kind of where we have our power in being how we choose to spend the time that we do have, and kind of reflecting on did my did I live my life in a way that reflected like what I truly prioritize, and
Mhm.
value? That definitely is an overarching theme.
Yeah. Wow. Yeah. I'm going to just repeat that. Did I live my life in a way that really reflects, what I value and what I prioritize? I think that's huge. And I think that's, that's a, oh, goodness, that's a big part of what um, well, I think my own personal life journey up to this point, at least,
Yeah, absolutely.
as well as, as a, segue of that is the work that I do with my clients, right? And guiding them
Yeah.
through that as well, of like really aligning our sort of external situations, external life, to really align with our own values and priorities. And yeah, I mean, that can be, ugh, goodness, and that can be hard, and it can certainly be quite a journey. And so it's interesting to, hear that come up. Um, I'm curious. Oh, and I also really thought it was interesting that you shared that they're reflecting also on the things that maybe we do not have control over in our life, and then also
Hmm.
those areas of our life where we did have or do have a sense of power and agency and choice. And so I
Hmm.
thought that was really interesting as well. Before we go on, I'm excited to share something that could really make a positive impact on your life. Do you feel like you've lost touch with your true self? Reclaim Your Radiance is Radiant Living Institute's signature coaching program designed to help you reclaim your worth, renew your energy, and restore your happiness in your life, career, and relationships. This 6-module program has already helped countless women regain control of their lives. Whether by setting boundaries in challenging relationships, finding strength through life transitions like divorce, pivoting in their careers, or rediscovering their purpose as they embrace new chapters of their life. Start your journey today and begin living authentically, unapologetically, and radiantly once again. Head over to radiantlivinginstitute.com/reclaim your radiance to get started. I hope you found that helpful, and if you're ready to explore this more, check out the link in the show notes. Now, let's jump back into today's episode. I'm curious, through this line of work and what you see and hear, um, and do day in and day out professionally, and sort of these reflections that you have heard,
Hmm.
how, if any, in any way, I'm curious, kind of taking this more on a personal level now.
Hmm.
So whatever you feel comfortable with sharing, how has that maybe affected the way that you approach your day-to-day life?
Yeah, yeah, no, I think it's huge. And I think to me, it felt impossible not to have it affect my personal life, right? Because it's like the types of questions I'm asking my patients every day, I have to like turn and ask myself as well. And I think the biggest thing for me, personally, and also what kind of inspired me to start my business was just kind of this sense of like, I don't want to wait till that point when I have that diagnosis or when I have this, limited prognosis to then really like clarify and start like spending all my time with the people that matter the most to me, or doing the things that I put off or said like, oh, I'll do that later, or I will, take that trip later, that kind of thing. So it really has helped me to reprioritize and be a lot more intentional with like how I want to spend my days and my seasons and my life, right? And yeah, not delaying it, but really taking stock of like more frequently checking in. And then if things feel off or they feel like I want more of something or less of something, like I think it's given me permission and almost like that empowerment to go ahead and do it because um, I don't know, like, no one is going to come do it for me, right? I've learned that.
Yeah.
And so, yeah, it's helped me a lot, like readjust my schedule at work and cut back my FTE and start my business to like kind of really help me to help others in this way as well. Because, like, at the end of the day, like we all have one life, right? And we want to like live it very, very fully. Like that's everyone's idea. They would all say, yes, that's what I want to do. But then in practice, like how that works for each one of us can be challenging to implement that intention because of just all of the roles and responsibilities and kind of societal factors and just all the things that
Hmm.
influence us. And so I think yeah, it's given me a very much a wider perspective on like what it means to have integrity and like have my inside stuff match my actions and behaviors and day-to-day things.
Yeah, absolutely. And that's huge. And, um, you know, that's also, one thing that I often will say and have noticed in my own life as well as the lives of my clients is that many of us we experience the greatest amount of sort of discord or distress in our life when that is not matched up, when
Hmm.
we're not living our external life in a way that aligns with our inner world.
Yeah.
And I think that's what gives rise to, this is my belief, that that's what gives rise to the greatest amount of sort of distress and sort of
Hmm.
conflicting inner dialogue about our life
Hmm.
and discord within our own life. And so as we move to align that, um, we find greater harmony and
Hmm.
overall alignment. Um, and there's a lot of things, as you mentioned, and I love that you mentioned all of these things, these different factors that can play a role into our hesitation in doing that, right? Because
Hmm.
there could be societal factors, cultural factors, different roles and responsibilities that we play. For many of my clients, it's just the massive uncertainty, right?
Hmm.
That can lie on the other side of taking what feels like a major risk, right?
Yeah.
You and I have
Yeah.
both started businesses. That can be a risk. You and I have both,
Hmm.
um, scaled back in practicing medicine, right? And
Hmm.
that can feel like a huge risk, right? Like all of
Yes.
these things, and there can be a tremendous amount of uncertainty. But I think again, having that guiding force being,
Hmm.
as you said, we all have this one life,
Hmm.
and we all do have this desire to live a life that feels full and whole. And so,
Hmm.
what that looks like specifically will look different for all of us. And, my company is called Radiant Living Institute. And I always say, well, a couple things I always say. One is a radiant life starts from within, right? So that
Hmm.
really is, I encourage my clients and I guide them through processes that we really start with looking within and then take those actions to rebuild the um,
Totally.
external world there as well, but also
Totally.
that I'm not here to tell anyone what their radiant life should look like, right? Like that
Right.
is going to be completely different for each of us, what a full and whole life looks like. Um, but then I think also remembering how you mentioned that many of your patients at towards the end of their life do reflect upon the things that they do have power and choice over in their life. And so
Hmm.
realizing that we can make that choice
Hmm.
at any time and a series
Totally.
of choices. It doesn't just stop with one,
Totally.
but that
No,
series of
that's so true.
choices. Yeah.
That's so true.
Um,
And something that you said that wanted me to reminded me of something. Oh, basically like, yeah, when patients are reflecting, right? And one thing, it's very common human experience of what you were speaking of earlier is like probably the number one thing that holds us back from making these changes and being like really true to ourselves is fear. And so um, I think that it's we can normalize that for ourselves, right? And for others, that it feels really scary to make a change. It feels safer to like stay in something that we're not like if we're honest with ourselves, we're not truly that happy, or we're not as happy as we think we might be otherwise, right? But we stay with it because we're like, it's too scary to change. And I would say that like the vast majority of people at their end of their lives say, take that risk, right? They look back and say, like, I wish I had had more courage to do that.
Mm.
Um, so I just think that's important for us to like keep in our minds
Yeah.
as we're
Yeah.
navigating it, you know?
That's really powerful. That is really powerful. And so much of this is our perspective, right?
Hmm.
Yes, it is completely valid to feel fear and to feel, with all of that uncertainty, with taking these big risks. And I've certainly felt it. I continue to have many moments of
Yeah.
feeling it.
Yeah.
And I'm human, we're all human, that's completely normal. And at the same time, for me personally, there's always this thing kind of in the back of my mind or in my gut and my heart that's like,
Hmm.
but what I fear more than any of
Hmm.
those risks is not having lived a full life that feels like
Hmm.
I've aligned with my purpose and what I've been set out here to do. And so it's
Hmm.
kind of like, okay, well, which fear is bigger, right?
Right, right.
and um
Absolutely.
and so I have another question for you that came up for me, which is I was curious because earlier in our conversation you mentioned that in the patients that you see and work with that obviously I would assume and think that most all, if not all, um, patients, when they are at least initially given a diagnosis or a prognosis that would then lead them to seek hospice and palliative care, would likely go through some process of grieving. And one step
Hmm.
in the process of grieving is a state of acceptance. And you mentioned that
Hmm.
some individuals that you work with, and I don't remember exactly how you worded it, but seem to be closer to or get to that place of acceptance in a bit more easeful way than others. And I'm
Hmm.
curious because I think another thing, I think it is a universal what you had stated that we all want to live a full life. I think
Hmm.
most likely another universal is that we all want to our end of life to be peaceful and the end of
Hmm.
life for any of our loved ones to be peaceful and with minimal
Totally.
to no suffering. you know
Hmm.
the fact is we're all going to have that day, right?
Hmm. Hmm.
For us and our loved ones, and that's just a fact of life. And I think also, you know that's always been the case. And I think that the COVID pandemic has also brought this to more of the forefront of people's
Hmm.
minds than
Hmm.
perhaps ever before. Um,
Yeah.
and so I think part of that, finding peace and minimal to no suffering towards the end of life,
Hmm.
yes, of course, relates to um, physically. And
Hmm.
also, emotionally, spiritually, relationally, like all of
Yeah.
that. So I'm just curious
Yeah.
if you have noticed any sort of commonalities in those individuals who have found that place of acceptance a bit more easefully that you
Hmm.
could share.
Hmm. Yeah. No, I think you're right. I think a lot of that like acceptance piece has to do with their where they're at like mentally, emotionally, and spiritually. And I also think that a huge factor, although I'm not like sure how to grade this where in it, but is to do with relationally. So if they have like really strong supportive relationships and they're facing this together, right? They have someone or multiple people in their lives who are like there to, um, you know, basically support them in whatever decisions they're making and help make the last chapter of their life, as good as possible, um, while also grieving, right? They're like grieving ahead of time, anticipating that loss. Those people seem to overall have more peace and kind of face it a little bit more realistically in some ways than the people who are either alone, right, isolated, or they have really challenging relationships, or they've lost touch with their children. They're kind of have um, difficult relationships. I think is a really big thing.
Yeah.
Um, And then I imagine there's definitely a component of like feeling like they didn't get to do some things that they wanted to, right? Or that definitely people who like retire and then they say, I was going to travel now and now I have this diagnosis. It's so unfair. It's like what they envisioned for their future is not happening. And that's really, really hard to reckon with for people if they have those, big goals or big aspirations that they didn't get to pursue. I think
Yeah,
those are really,
yeah.
really challenging.
Yeah, absolutely, absolutely. I don't know the name of it, but I think there's another form of, I don't know if it's another form, but it's another layer of grieving, is grieving
Yeah,
those dreams um that we were unable to attain. Just
totally.
adds to it another layer of grieving. Well, thank you so much. This has been a really insightful conversation. I really appreciate you being
Absolutely.
here and sharing this with us. Um,
Absolutely.
for anyone who wants to learn a little bit more about you, your podcast, the work that you're doing, where can they find you?
Mhm. Yeah. So I have a podcast called Vibrant Humans. It's on Spotify or Apple Podcasts. That comes out every Wednesday. And then you can go to my website if you want to find out more information about coaching services and what that could look like. I primarily work with women who work in healthcare and are also raising kids who just feel like something is off and they want more sense of balance and peace and ease in their day-to-day life.
Great. And I will include those links in the show notes below. Thank you again for being here.
Thank you so much.
I know you have so many choices for how to spend your time, so I thank you for being here today with Essential Self-Care. As a gift, download your free workbook, 6 simple yet powerful steps to create your radiant life at radiantlivinginstitute.com and start your journey to a more radiant you.